I come in, I do my non-select combination. I'm Nurse Philomena. I'm going to be assessing your cardiac and then your neck pulses today. Can you please tell me your name?
Bridget Monteri.
Your date of birth?
2nd, 2021.
And I'm going to be asking you questions concerning your head and your neck, heart, and then your neck. Have you had any heart attack before?
No.
Any heart surgery?
No.
Okay, that's good. Okay, now I'm going to do the vital signs assessment on you. I see my patient as I'm talking to her, as she walks in, she's steady gated, and I see her skin is moist, she has no scars, she has no lesions. I'm feeling her body temperature, it's warm. She has a very good sense of humor. And then I'm checking behind her bed, it's okay. I'm checking her lower extremities. There is no lesions, there is no scars, there is no edema. And then I'm checking her capillary refill. It's okay. She is hygienic, she's a very neat person. Her respirations are normal, within normal range. So now I'm going to ask my patient I'm going to position my patient in the supine position. So I'm going to adjust the bed to 45 degrees. So can you please lie flat? So now I'm going to auscultate her carotid arteries. So as she is lying down, I'm going to use the bell side to check for the carotid arteries and to check if there is any abnormalities. I'm checking there is no abnormalities. So I check. And I'm going to ask her to turn her other side for me to check. So I'm checking. It's within normal range. And now I'm going to palpate her carotid arteries and see if there is any abnormalities. So there is no abnormalities. That's normal, within the normal range. So now I'm going to check for her jugular vein. So I asked her to slide her head onto the left side a bit, and I'm checking. I see the vein right here. And then I asked her, I see a little bit of pulsations around this side, distant pulsations. And then I asked her to turn to the other side for me to check on the other side. That's okay. So now I'm going to assess the anterior, the peripodium of the chest, that is the anterior of the chest. I'm going to palpate and then see if there's any abnormalities. I palpate and then I palpate the apical impulse too to see if there's any abnormalities. So I palpate. The apical impulses on the 5th intercostal line, right across the mid-clavicle line. There's no abnormality. So now I'm going to auscultate with my diaphragm. So I use the diaphragm to assess the Z line, that is from the aortic to the pulmonic to the ebb and to the tricuspid and then to the mitral where we have the episcopal line. So I put the diaphragm on the aortic line, that is the 2nd intercostal line. here. So I push it across the Louis line that is under the suprasternal notch, and then push it across to the pulmonic line, right down to the Erb's line, right down to the tricuspid, and then right down to the mitral where we have the apical impulse. And I'm assessing for the S1 and then the S2, the dab lab. So as I've auscultated with the diaphragm, I'm going to do the same thing with the bell, but this time I'm going to ask my patient to sit up and then lean forward a bit. So as she is leaning forward, I'm going to use the bell to start from the aortic, right across the Louis line to the pulmonic, come down to the Erb's line, to the tricuspid, and right down to the mitral where we have the apical impulse. And I find there's no abnormality in the murmur sound. It's all normal, within normal range. So right now that I've assessed and I've seen there's no abnormalities in the sound, that I hear only the S1 and then the S2, which is the lap dub, I'm going to ask my patient to lie flat and then turn on the lateral side. So I'm going to check for the apical impulse, the mitral. So I'm checking for the apical impulse, which is the fifth, on the fifth intercostal line, and I still don't hear any abnormal sound. So I'm going to ask my patient to sit up